to the East King Chambers Coalition webcast for May 19th, 2020. Today we're joined by Washington State Senate Education Chair, Lisa Wellman, House Human Services and Early Education Chair, Tana Senn, and Committee Deputy Ranking Member, Representative Carolyn Eslick, as they discuss the state of need, education, childcare, and human services.
Thank you for joining us for our fourth webcast as part of the East King Chambers Coalition series. Our coalition brings together 11 chambers of commerce on the East Side to advocate for important issues facing our economy down in Olympia. I'm Joe Fain, CEO of the Bellevue Chamber. I'd like to start by thanking our East King Chambers Coalition sponsors, Boeing, Comcast, Microsoft, the Port of Seattle, Puget Sound Energy, and the Seattle King County Realtors. Before we turn over to our presenters, I want to invite you all to use the Q&A and chat feature on your screen to ask questions or engage with your fellow webcast participants throughout the program. Now, the executive branch, through the Governor and Superintendent of Public Instruction, has been out in front on schools and human services over the past few months. Today, we'll hear from three of the most influential legislators on education, childcare, and human service policy to hear their priorities and plans as they approach a potential special session this summer. Now, to moderate this important discussion, I'm pleased to turn the program over to Beth Sigel. Beth's passion for education advocacy was sparked in 2002 when her oldest son was diagnosed with autism. She's worked at the federal, state, and local level on many issues to improve our schools, including a first-in-the-nation law in Washington state to support the professional development of paraeducators. An attorney with a background in special education law for the past 10 years, Beth has also served as a court-appointed special advocate here in King County Superior Court, where she has focused on foster children with disabilities. Beth has served in multiple roles with the Parent-Teacher Association at the local and state level and previously named Lake Washington School District PTA Outstanding Advocate of the Year. Beth, thanks so much for being here.
Thank you, Joe, and thank you, everyone. I'm going to go ahead and turn it right over to our first guest because I believe some of our guests have some tight time limits. So we're going to start with Senator Wellman. She is from Mercer Island and represents the 41st District and was elected in 2016 after a 25-year career in technology and marketing. She is a passionate advocate for education, and she began her career as a public school teacher and serves as the chair of the Senate Early Learning and K-12 Committee. She also sits on the Higher Ed and Workforce Development Committee and is a board member of Thrive Washington, which is a terrific nonprofit focused on early childhood education. And so, Senator Wellman, welcome to our panel. And we'd love if you could just make a few opening remarks on how things are going at this time with education at this unique time with education in our state.
It's hard to make a few remarks, but thank you, Beth. It's hard to make a few remarks because education is part of such a complicated system that it is all encompassing in terms of what we were doing before. And probably there's such another level of complexity because we're not in school and we're not in buildings in front of teachers. We have really such a wide variety of things happening across the state. And then different groups of students are experiencing it in different ways. Of course, there's lots of things in common, but we do know that there's special populations that we really need to attend to individually. I'm going to have to leave early, and I am sorry, but I'm due for an EOGOAC meeting this morning, which is a 4-hour meeting that will be about, this is the opportunity gap. And this is about education. And normally we do discuss what's happening in school and how that is impacting minority children and teachers as well, ethnic groups, etc. And so, of course, one of the things that we're looking at now is how is this special set of circumstance, which is certainly attacking the coronavirus, is seeing its presence in minority populations to a greater extent than in our broad population. We know that children in poverty are having a really difficult time. Families are, and they're incredibly stressed. We have the newly poor, people who've never been in poverty before and who are now out of work, living on unemployment. Hopefully there's that, but there's food scarcities. So we have many, many challenges. And then, fortunately, I've been involved in broadband for many years. And we're looking at the places in our state where those children have no access to broadband, much less the devices. And even in our own Seattle area, we know that there are many children who, even though they may have broadband, they don't have devices to get online. And so that's been a challenge, making sure that we get something out to them. So I can't think of anything that we're not discussing with regard to how do we respond to this crisis. And I know Representative Senn is going to be a much better speaker about childcare than I am, and the complexities of that. Again, we're going into other things about how to handle those populations. We spoke about foster kids. I was on the phone with Lisa Chen, the new head of Treehouse, talking about what we're seeing with them and what's happening there. So just to give you a sense, we have many foster parents who are themselves so stressed that they're calling up and saying, I can't have this child in my care any longer. You have to come and get him or her. And they will, then we don't have enough parents who are stepping forward now in homes that we can put those children in. So that's a problem. Later today, I'm going to be heading up a team of, or a meeting of legislators, people from DCYF, people from higher education, people involved in policymaking in education. And we're going to hear from Dr. Wissow, who's head of pediatric psychiatry at UW, because while these children are away, they're not seeing their friends. They're in very challenging situations along with adults. And we have to prepare for them to come back to school. And what will teachers see, and how can teachers respond? So lots of things are on the page. I'm happy to take questions. It's probably easier than trying to talk about all the meetings. I think I've been in more meetings since I left the session and working, kind of 9 to 9 almost every day of the week, trying to really respond, and then thinking how we're going to return. And are we going to return with, will we have contact tracing? Will we have testing? Will we have medications that we feel are better? The hospitals are in better shape now, as long as we don't go back to where we were, originally. But what will we have to go back with? And will we have to do social distancing? In which case, we don't have enough room in our schools to have people go back and do social distancing. Will it be different in King County than it is in other places that are have smaller school districts, have not been as impacted by the virus, et cetera? So I'm going to stop. I am going to stop.
Thank you. No, it's actually great that you gave us so much detail, because as I'm looking at the questions that we've all been working on for the past few days, you definitely have hit on most of them already. So that's fantastic. I think that, and in particular, what you're saying about foster children is something that we're definitely seeing in that arena as well. I think one thing that would be great for you to touch on, because there are just so many decisions that need to be made as we look towards something that will look like reopening schools in whatever format that's going to be. So I guess a question that we have is, moving forward, the decisions around reopening schools, in your view, how are those decisions going to be made? Are they better left to the state legislature, so that the perspectives and experiences from across the state are considered? In other words, that we make sure we get the views of Bellevue and Yakima and everything in between. So how do you envision that process moving forward? Up till now, it's mostly been the governor and OSPI, because we've had to make decisions quickly. But moving forward, how do you think those decisions will best be made?
So I think that there are several levels to the information that we have to have at hand to understand how to make decisions. Some of that is actually information that comes from outside sources. So we have to understand from the medical community what their sense of the disease in particular places is. And I do suspect, as I indicated, that we can make different decisions for different places. The local school boards ultimately will act, regardless of whether the governor says the schools may be open. A local school board is in better position to say, this is our specific situation, this is what we can or cannot do. And so I think that it's going to be on many levels. the governor will give overall, authority, presumably. I think that we have to be able to determine what the, looking as a systems person, I'm looking at all the situations. So just to give you a sense, will we be able to open with social distancing or not? That makes a huge difference. If we have to have social distancing across the state, because we still feel the virus is very prevalent, is active. We expect it to continue to be over this year, maybe even next year. We don't know. If we have to have social distancing, we can't fit all the kids in the schools. We have to either have 2 sessions during the day. We have to have some kids coming Monday, Wednesday, and alternate Fridays. We have to have perhaps grades K through 6. And then everybody else social distancing. There are so many permutations, and it will really depend on the locality as to what they can or cannot do based on some very specific things of social distancing, et cetera. Whether we can test and find out that the children are not carriers, the children are not infected, that we can, do scans on a daily basis, that we have nurses who can do these things, et cetera. So there's a lot of things, and I think everybody is going to be involved at different levels as we move forward.
Thank you so much. I think it is just going to be, as you've spelled out so well, just a multitude of factors and how we arrive at the systems. And needless to say, such a big state, lots of kids in school, so many different ways to approach this. What I'd like to do just a little bit too is what we know that OSPI has already started a stakeholder process to gather information and get feedback. How is that going to work with OSPI's recommendations and the legislature? I mean, is that something that's going to need to be addressed in a special session over the summer so that we're ready to hit the ground by fall? I think especially when we're looking at parents and we're looking at their employers, which is something that's going to be so important for this organization for purposes of just trying to plan what's going to roll out. But what do you view in terms of the interplay of the legislature and OSPI?
Well, I sat in that meeting for 6 hours on last Wednesday. There's another one scheduled. There's another one scheduled for this Wednesday, and so there were about 170 people in the meeting. I have subsequently talked to OSPI about the value of that meeting for me, and I'm hoping that we will be able to really get a lot of input. But just to let you know, so we have school directors. I'm in contact with that association of school directors on almost a weekly basis. The principals, the education service districts, there are 9 of them across the state. They reach out to all the schools and districts within their area, and they're talking to those schools to get a sense of, what's going on. So in terms of connectivity to the stakeholders, I think that many of us, I'm sure Representative Senn and Representative, that everybody is reaching out and getting information. I think now we're getting information in the stakeholder group from doctors directly, not through associations, as well as parents and business people, et cetera. And that's helpful, but I'm going to have to wait and hold my comments in terms of, is this going to be really very valuable? It may be valuable to OSPI. It may not be valuable to me. We're going to wait and see. I think that we need some really good, very specific information and a lot of time to think about in small groups, to think about what we're hearing and what it means to us.
And then my final, you can all chime in at various points, but I just wanted to get specific questions to you. And this will actually be a good question for all of you to pivot on, I think. What are you generally hearing from the students and families in either your district or just in general reaching out to you about how's it going? There's a sort of a gritty reality of trying to do all these things. What are you hearing from families in terms of how things are going with online schooling in your district or just generally?
Well, let me respond that in terms of our K through 12 system, that's 1.1 million kids across the state. And so it's not just a district. For me, it can't be just a district issue.
Sure.
And in point of fact, it's very, very different. I can tell you that in some places, when the governor made the announcement, I think it was on a Thursday, giving the parents one day to get prepared. When he made that announcement, immediately some districts went into overdrive and actually said, okay, next week's going to be a vacation week. Meanwhile, teachers will come in and we will prepare to understand how we can respond in remote learning, distance learning, and you'll get a week to really prepare your lessons for this new reality. In other cases, people heard other things and they said, it's going to be magically over and we're not going to do anything because, and so they waited several weeks to do anything at all. I've got places in the state, obviously, and it is east, both sides of the mountains where there is literally nothing. We scramble to get hotspots out, but of course, you're not going to put your kids in a car, two kids in a car, drive for half an hour, 40 minutes to get your children to a hotspot with a device, if indeed they have a device. And that's just not, really working. So there's some kids that are really challenged. I will say the schools responded because one of the most important things schools have done right now across the state has been in getting kids food. And so the kids on, free and reduced lunch, and then even the family that was on free and reduced lunch, the day after the governor's announcement, the buses went out with packets of food and have continued to do that. We're concerned about the summer session now in terms of how that's going to happen and, going forward. And so working very hard to see if we can get as fast as possible broadband out to those unserved areas, devices out to those kids. And frankly, it is a district, here is where the districts do step up. If a district demands that this certain types of education that they're not happy with what they're seeing, then it's up to them to make sure that they're setting that charge. We are talking about accountability and making sure that kids are getting what they're supposed to get. And so lesson planning for moving forward, not only this year, but putting plans in effect for next year is really going to be a very important thing. And that's ongoing right now. We're waiting for those reports to come in for this immediate time to see how schools have been held accountable for this time, because they do have accountability. And then next year, we have to plan on whether or not, if we do go back, then we could, based on what we're hearing, have to, go back down to, in certain areas or across the state, back down to stay at home and schools closed. Complex.
I'm gonna toss out a question from our audience. I haven't gotten around to the introductions of our other two panelists other than what Joe did, but for this question, I'm actually not quite sure which one of you, or maybe all three of you, are best equipped to answer, so I'm going to let you all decide. And the question is this: will some of the stimulus dollars, so that's federal stimulus dollars, be used to prepare our system for some sort of staggered reopening? And if so, will any of those dollars be used to help families adapt? Specifically, if people need to go back to work, which, as you know, is such a huge issue.
This is Representative Senn. I'm happy to jump in on that. So most of the CARES Act money, which is the main money that the state has gotten from the federal government, has really been for expenses related to COVID and very directly related. For some of the money that has gone out, it has actually required receipts to be submitted in order to get the money handed out. So it's pretty direct response and less planning at this point. I think that is one of the reasons why there's such a big push to have additional packages, many reasons for additional packages. But part of it is it's the original CARES dollars was really very immediate, passed very quickly and right at the beginning of the pandemic. To help with direct expenses, and now we're seeing different things emerge, and we're seeing where the biggest expenses and the biggest unknowns and the biggest needs are arising. And next package will hopefully be able to accommodate that more and look a little bit more for the future. For instance, local governments and state governments receive mostly no dollars directly to help with a recognition that there is less income coming in, and yet services need to be provided. Clearly, childcare is such a huge need, and there was some, but for anybody, I think anybody would say not enough. And certainly on education and the idea of feeding kids and taking care of kids while they're not in school, all of that has been kind of stopgap and not really clear how the money flows or who's providing that or where the specific needs are. So I think I would say that current dollars, I would say in short answer would be no, it's not really for planning for the future. And so we're going to need to figure out how to do that. The legislature before we left did pass a $200 million fund for the governor to allocate where needed most. And those dollars are a little bit more flexible and haven't all been spent yet. And so some of that has been planning and some of that is for emerging issues. But we are definitely going to need to figure out how to plan ahead and what different dollars will come into play there.
Thank you, Representative Senn. And since you last spoke, I'm just going to reverse engineer here and give a little bit more of your background for our audience to hear. So Representative Senn represents the 41st District, and she is the chair of the House Human Services and Early Learning Committee. And she's also the co-chair of the Oversight Board for the Department of Children, Youth, and Family Services. And there was a Bellevue Chamber webinar with Secretary Hunter recently, which was extremely productive. And before you joined the legislature, you were on a member of Mercer Island City Council, and you serve on the board of Hope Link, terrific organization, and previously with the board of Mercer Island Youth and Family Services. So thank you so much for joining us today. And because we were talking about those budget issues, this is a great segue to another question from our audience. And I am going to try to give as much as I can, give you the questions from the audience before the questions that we prepared. The state is facing a big budget shortfall. Mm-hmm. And any of you can chime in on this, should any of the expected upcoming cuts fall on K-12? Is it possible to balance the budget with some reductions to K-12 education funding, given the large portion of the budget it constitutes, which we know is over half of the state budget? And then I'll go ahead and toss it out to you all. Thanks.
Well, I'll just mention that approximately 94% of the K-12 budgeting that comes from the state is protected money. So that is, as our paramount duty, we've already been through McCleary. That money is locked and loaded and must be spent on education. However, that for the school districts, that's certainly not all of their budget, and there's other issues involved. So I think that here, just a simple response, even though we have money for school under normal circumstance, these aren't normal circumstances. For instance, while we pay for transportation in that, if we have to go back to school and we have to go, let's say that with split sessions, where there's kids coming from 7 a.m. till sometime later, and then some other kids coming through kind of later in the day. For places where those kids are not using city buses in downtown Seattle or walking to school, but there are buses going around to picking up kids, they would have to make 2 rounds of trips. People would be, the bus drivers would be working a much longer day, and we don't have funding for that. So we have funding for, kind of the normal and not this strange situation. What if we have to serve meals twice? And so we have, we're paying for people in the lunchroom to be making meals right now, the way we're doing it now. They do that for a period of time for the kids, but now their day would stretch much, much longer. We would have to pay for that. I'm concerned about that 20% of our teachers are older and are due retirement if they choose to take retirement. We're concerned about whether teachers will be leaving, and what that will do. And will they be able, actually, under this various health circumstance, to be in the classroom? So lots of things to be considered in terms of the funding for K-12.
So I'll mention it from the impact on the rest of the budget. So as Senator Wellman said, McCleary is pretty much protected as basic education, and so it's about 55% of the budget. Other parts of the budget are also protected, like having to pay off, our debt, Medicaid match from the federal government. So of course, especially with all these health needs, we can't really cut anything in that area. Department of Corrections, we have to still maintain our correctional system. And so it leaves about, probably at maximum, about 25% of the rest of the budget that will take 100% of the cuts. And so when we think about what is left in that is higher education, that is human services, that is childcare, that's food services. So that is those are areas also of huge need right now. And when we look back at what happened during the 2008 recession, we did do cuts in those areas as well. And we, frankly, we're still recovering from those cuts. So we need to really figure out how we can be smarter this time around, how we can maybe look for additional revenue, how we can make sure that we are not doing long-term damage with the cuts that we will need to be making.
So this is Carolyn Eslick, representative for the 39th district, and I'd like to speak about my rural school districts. We're different in that most of them are on the levy equalization, and that means that they are very concerned about that being changed for them, and that will really be devastating for the school districts in Cedar-Woolley and Darrington and Sultan and Monroe. It is to talk to my superintendents and find out what they're doing has really given me some hope, because they are already looking at not hiring, of course. They are looking at the budget as it was during the big recession, knowing that there will be definite tightening of the belt, so to speak. What they're concerned about are the special ed and the at-risk groups. They are worried that there's going to be a bigger gap than ever, because they find that access to connecting to the internet is a problem. They find that their equipment that they have, in fact, Sultan had purchased 600 laptops and had gotten them for a great, great price. So they were stockpiling. So they were ready and they had hotspots. But what they found were that these computers were great for the elementary school kids, but not so great for middle school and high school. So they are looking at having to purchase or grant, hopefully some grants available to get some laptops that are really going to work for them. In our rural areas, we have some, the internet service is spotty at best. And last year, I had the opportunity to invite the new director for broadband that had just been hired. He works for the Department of Commerce, and he is such an expert. I was thrilled to be able to find out what he's got, that he developed himself, a dashboard that when a community is looking for internet service, he connects with that mayor or the local leadership and sends the dashboard to the community, and they individually answer some questions, and he can detect what kind of service they have in that location. So that's already in place, and it had been kind of put on hold during this time, but he's gearing up again to work with the communities. That gives me hope. I think that what happened drastically when one day we're going to school and the next day we are not, and the teachers had to prepare within a week's time to be able to service these kids, by the time we reopen in September, and you hear me say that in a positive manner, that things will look different. But if it means that they're going to stagger their days, the kids will go part-time and part-time on the internet, that's a great possibility of happening. And they will be more prepared for that. I believe that the kids today are looking at this time as a great summer vacation. But by the time school starts, there's going to be a routine again. And they will get back into that swing and be able to study and get back into the education that we need them to be getting. So I have high hopes in that. And I think that we are all learning from this, and it is going to look different. And it's just the way it is.
And thank you, Representative Eslick. And I want to make sure I introduce you to our audience as well, give a little bit of information about you, particularly since you're bringing the views of other parts of the state to this forum. Representative Eslick represents the 39th District of Snohomish and Skagit counties and was first elected in 2018. And she hails from, and I'm not gonna lie, this is my Puget Sound bias coming through here. Is it Sultan?
Yes.
Okay, thank you. Where she served 9 years as mayor. She operated a restaurant for over 20 years and founded and helped run Grow Washington, a business development and retail incubator. She also served as a board member for the Boys and Girls Club and is ranking Republican on the House Human Services and Early Learning Committee. So that's great. You're bringing that small business perspective as well. In following up with some additional questions that we're getting from our audience that I think tie in well with the issues that you were just talking about. In your view, and you all can maybe take turns on this, is in-person education going to start on time this fall? Will it be staggered? Will it be younger kids attend classes in person and older online? Or what are the options being considered, and when will we know?
So I'm going to have to leave soon, so I'm going to just jump in here and say that we are looking at what are the ramifications of any one of the decisions, assuming that it will not be the same necessarily across the state. As Representative Eslick talked about, some of the issues she represents, of the children, there are a few cases of COVID. Hopefully, as we go forward through the summer, we're going to see significant changes in overall populations as to what is happening. I'm hoping that people will understand that a lot of that is based on how they individually respond. When people come together in mass, in person, without tracing and without, kind of the kinds of protection that they might be using, we wind up with waves of stuff coming back again, and then everybody has to get back to stay at home. So hopefully people will really respond to their individual responsibility. That's what's keeping everybody safer. In terms of how we will go back, so there will be different protocols depending upon where you are and what your situation is. I really think now, as Representative Eslick was talking about, that we hope for the best. The best would be we could all go back, everybody is tested and we go back up to a completely normal situation. But I also think as representatives, as people who are serving on various committees that oversee some of these processes and procedures, that we prepare for the worst, that we prepare so we don't have to go back and start, thinking it through. So we have to right now be thinking of all the what ifs. I am a good example. One of the things that Representative Eslick talked about is working with Russ Elliott in the broadband office, and I'm delighted, that he is there and working very hard. But understand that even if we get money out to the rural areas to run fiber, so that it's broadband, it's not, a Yes, you can do emails. Yes, you can, maybe go online and pull something down, but you can't look at a video or, see some live streaming. That you can't be online with two other members in your household. And then think about the cost to the household. Think about what this audience in our area, what we pay for our online services. I can assure you that in many cases, $10 or $20 a month is a lot of money, much less $100 or $120 a month. So we have to look at that. One of the things that's the reasons that we ran the bill to create the broadband office was because there is a lot of federal money available. Even before COVID, there is the Connect America Fund. And so we're going after that money. But to get that money, we had to have a broadband office and we had to have a strategy to run fiber. This is a utility. This is every household needs to be able to turn on the lights and get electricity. Today, every household needs to be able to have high-speed broadband in order to really function in the way we're working in our society. We have to be prepared. Even if we go back to school, we have to be prepared, as is now happening in China, for another wave, and that's what we're being told. So we have to know that we have distance learning covered as a backup to school as usual. And I'm going to have to go now to another meeting. So thank you very much for the opportunity to share some time with you.
Thank you, Senator Wellman.
Thank you.
Bye, Senator. I'd like to follow up with the senator's discussion on how we're going to set up and how we're going to proceed. Definitely, we have to allow our local school districts to decide on their own. But as doing some research myself, I found American School Health Association has what they call a school decision tree, and it shows 3 different scenarios what they can do when they find out there is a case in their school district, what kind of policies that they follow. It's these kinds of things that I think, as long as we are putting this virus front and center of everything that we are doing in our life for the next year or two, we will be okay, and we're going to live through this. And the schools are imperative that we continue our school and our education, and with some sort of normalcy. For the kids' sake and for the mental health of our community and our society. So as long as we have some parameters, but allowing our local school districts to make the final decisions on what that's going to look like is really important.
And I think Senator Wellman and Representative Eslick covered a fair amount of this. So one other component that I'll just mention, I've been working to bring together OSPI and the Department of Children, Youth, and Families and advocates and providers around the communities, in particular, to talk about, regardless of the plan, the ideal plan that's rolled out for education, a critical component is what happens to those kids and for those families and for those businesses if school is not back to normal. And what I particularly mean by that is what happens with childcare. A lot of times we talk about childcare as 0 to 5 and some after school care, but obviously with the schools closed, what we're seeing more and more is that childcare is really 0 all the way through 12. A third grader still can't be home by themselves. So if we go to an A-B setup for school, or an AM-PM, or even if there is an outbreak and schools have to close for a couple weeks, families and parents presumably are going to be back to work or in some semblance of work. And so we really need to make sure that as we are planning for K-12, that we're recognizing that we have to deal, which I focus on a lot, the whole child, and in this situation, kind of the whole family. And that means taking care of the whole child, even if they're not at school. So if they're not in the classroom every day of the week from 9 to 3, where are they? And they can't be at home alone. And so that means either childcare or huge flexibility for parents to be able to stop and start work, which means businesses have to be flexible. But we really have to be thinking about that whole scenario and not just what is happening within the classroom, but what's happening outside of the classroom.
So I totally agree with Representative Senn. We have found in our childcare providers in the rural areas, many of them have gone out of business. When the whole shutdown happened, I had a conversation with our superintendent of schools who were ready to open for childcare, but did not want to interfere and interrupt the private childcare providers. So in the end, they decided not to provide that. And as I speak to my childcare providers that are still in business today, they still are not at full capacity. There are still so many people out of work that are taking care of their own children. It is definitely going to change, but it will not drastically change overnight. In my opinion, our businesses, as they open, they will be hiring back people on a smaller scale. So it's going to be ramping up slower than fast, and believe that we'll be able to work some of these things out. Boys and Girls Club have stepped up to the plate. They are doing what they can do for childcare. And in the end, if the school districts need to participate, I know our rural areas will be doing that too. Do we have any more questions, or should we
I was going to say, we can fill the time if you want, but we're waiting for Beth to pose a question to us.
Well, you know, we talked briefly about special session. It was mentioned, right, Representative Tana? I know that that there has been no definite decision to have it, but on the other hand, our budget is looking so bleak, and our sales tax is so bleak that I believe we're going to have to come to some kind of conclusion in the near future. And I know we're waiting for the budget in June to come through so that we can kind of have a better handle. And we also have been wanting to make sure that we have a good tight agenda when we come in. Mm-hmm. Is that what you hear too?
Yeah, so I think waiting for the revenue forecast in June, so we know exactly, or more projected, what the pain will be. And in addition, a lot of the next budget goes into effect July 1, and as you can imagine, it's much easier to prevent expenses from happening than to claw back payments that have gone out. And so, if we want to or need to postpone increases in certain areas, new programs, raises, whatever it may be, it's much easier to do that before July 1, before they go into effect, than it is to claw that back. So hopefully we will meet before July 1 to make some changes to the budget and some needed policy changes to address this COVID situation as well.
Just to mention the drastic reduction, unofficial projections on tax receipts so far are $7 billion down. That's 10% over the budget numbers. And it says early actual from March suggestions, bigger drop than that. The governor's asked for a 15% reduction in department agencies. I haven't heard how that's coming along, but it's a start. And we're going to definitely have to be looking at those kinds of cuts. I know that this is going to be worse. I believe this is going to be worse than the 2008 recession.
And $7 billion over the next 4 years. So yes, it will definitely be interesting to see how that goes. Which again, the earlier we do cuts, or we prevent expenses. I've got 2 high schoolers, and we keep telling our kids the best way to make money is to not spend it. And so similar, I think, for our state budget, the best way for us to fill that $7 billion anticipated cut or revenue shortfall is to not spend it in the first place. So I think that we really need to look at that. But also, I will mention that just even looking at the comments in the chat box, if people are not able to pay their rent, then they become homeless. and it's more expensive to get them back into their homes. And so people want that. We want to make sure that people aren't starving, that they have the food that they need. And what we have seen and what Senator Wellman mentioned at the beginning is that we have a whole new community of people who have been on what I would call public assistance, which includes the unemployment. And those are expenses. And, we have to recognize too that there were people who this is their pandemic. This is the first time they might be on needing help and needing a safety net. But there are people who have had their own personal pandemics happen to them and will continue to, whether it's the loss of a job, it's a health situation, it's a death in the family. And those people have been needing assistance. And so we know that if we eliminate the human services, if we eliminate the safety net, we're not doing what's right for our community, for our constituents,
Can you hear me
for
now?
those in need. So it's a big issue, and it's a balance of where do we cut, how do we cut, and can we make sure that we also think about and incorporate additional revenue to make sure that the landing for our families, for our constituents is softer, and that we are able to have an economic recovery. Because again, if we cut childcare, we're not going to have an economic recovery.
I just wanted really quickly, can you all hear me now?
Yes.
And I want to apologize. Like everybody else, I have 3 kids and a dog. And so I did have to mute for a second, but I can hear you now and I'm back. I apologize for that. But I did hear everything that you both shared, which I think are incredibly salient points moving forward as we look to balance these competing issues around businesses, childcare, access to education at home and in a brick and mortar building. And I think what would be great to hear from both of you is even during normal times, as we know, the way we fund schools, the way we fund access to lots of important social services that support schools, it's not equitable. And the concern that we're hearing from a lot of parents, from a lot of social services groups, is that if we use the current system that we have to fund needs during COVID-19, we won't fund the groups and the people with the highest needs. So if you think maybe of an analogy, in an emergency room or in a hospital, when you have a group of patients, you treat the ones who have the most pressing needs first. But in our current funding, the way we fund things in this state, that's not how it works. The Seattle Times actually did a pretty exhaustive article about this recently and pointed out the fact that the cuts that OFM and the governor are proposing to the state budget moving forward will actually hit the highest need populations the hardest: foster children, Department of Corrections, et cetera. Can you all address how we can change that trajectory so that moving forward during this pandemic, those with the highest needs are served first?
I mean, I think that's a great point. And, as I mentioned from the beginning, our budget is such that the only places that we can make cuts are in those places that help people, kind of the human services safety net area. And they're the only places that aren't tied down, if you will, in the budget, that aren't an entitlement, aren't a requirement. And so the pain feels even more in that area, because 100% of the cuts that are necessary, or I guess, again, in addition, if there's no additional revenue, 100% of those cuts need to be felt in just 25% of the area of the budget. And so that is really, those are pain points. And so, when nobody is going to be happy with any proposal or any recommended cuts, not one, it's going to be really painful. And because they're no good, we wouldn't be spending the money currently if we didn't think those were really valuable services. And so there is going to be pain for sure, and it's not going to be pretty. And that's why people are going to be talking about new revenue, to make sure that we are minimizing those cuts. But of course, will need to have cuts made regardless. And similarly, on those who need help the most, the first couple weeks after schools closed, in fact, the first week of school closures, I was hearing from some parents saying, my kids are falling behind and we need to open and get online school going right now. And special ed and people with lack of access to broadband and people who might be hungry and people who might have a sick relative be damned. Now, clearly they didn't say that last part, but in my mind and what I was reading was, we need to make sure my child is moving ahead right now and not having to take care of or address the people who might have challenges. And that's not how our society works. We need to make sure that we're bringing everybody along. And so the schools were really focused on feeding people first, making sure that they did have access to technology, make sure that teachers and families were healthy and safe. And so that's why there was some delay in a lot of areas. And I think that also just speaks to, we need to really make sure that we're looking at not just everybody who can, but looking at everybody.
Thank you, Representative Senn. I totally agree. And there is no magic bullet when we go back to session on what we're going to do with the budget. But I want to reach back in my history. And my first year of being mayor was the recession, 2008, 2009. And what happens when budgets are tight is that communities come together stronger than ever. We started a volunteer group that had over 500 people that were available and ready to help. And that's what we find under these circumstances. So there might not be as much money coming down from the state, but there's going to be more community involvement, more family units. And in my opinion, if there's one thing that this has all created, is more dinners at the dinner table, whether it's takeout or you're in the kitchen working together. Those are the things that I think we're going to come out stronger with. Mm-hmm. With that said, we have a real problem with our mental health. And I think that we're in crisis with that.
Yes.
I had a phone call from an employee, and Compass Health is closing 3 offices, one in Monroe, and Snohomish, and Marysville. I was panicking, thinking about these hundreds of people that were not going to be serviced. And so I had the opportunity to talk to the director, and yesterday he assured me of some things. The services, direct services are different because people are not coming into the office. But he said 71% of their clients are on telehealth. And that was encouraging to me. It's not the same, but it's something. They can at least reach out and have conversations. And they are not unemploying any of their counselors. They're all going to stay working. That was encouraging to me. I suggested that if they needed, when things get open, if they needed some new locations, that they don't open their own office, but they go out to the schools, which I am an advocate of. We need more mental health providers in our schools. And they can also be part of the family support centers, which we have several in our rural areas, that can be the go-to it for all the community, all the family problems, which always empower people more than just the handout. It's the hand up. So
I did have one.
Yeah,
I did have one as a follow-up, and I think it will probably be our last question. But this is probably a very important question, which is, I know no one, and as Representative Senn aptly pointed out, cuts are hard. No one wants their budgets cut. If we can't cut, we're going to need to arguably raise taxes. Do you support raising taxes? I'd love an answer from both of you. Will you support raising taxes? And if so, what kind? How would you raise them? Raise them on what? Raise them in what form?
Representative Eslick, go ahead.
I would be glad to. I do not support raising taxes. Our people are they're either using up all their savings right now to survive or borrowing money from family and friends. We cannot add more taxes to their life at this point. We cannot do that. So I will be voting no for any new taxes. And in fact, we need to look at all the bills that we passed last year that had anything to do with the budget and increase in taxes. And we need to postpone them for a couple of years. So I'm very strong and adamant about that.
I would support additional revenue. I think it has to be realistic and it has to make sense, and it can't impact those on the lowest end of our economic system. The reality is that, if there's any new revenue, any brand new streams of revenue, it would take at least a year to implement at a minimum. And so, we can look at that, but that's a long-term solution. And I know that a lot of businesses are looking for payroll deductions and workers' comp forgiveness investments right now, which make a lot of sense as well. And so when we're looking at additional revenue, it has to be something that we can implement right away, and it has to be something that doesn't damage our small businesses and those at the lowest end of the economic spectrum. So there's lots of conversations as to what that looks like. Lots of things that will be proposed that will be rejected and that should be rejected. But I think we have to have an open mind because, again, as we've talked about, there's nothing really that people are advocating that we should cut. Thank you, Representative Eslick, for bringing up mental health. That was dramatically cut in 2008 in the recession, and we have been living with those with the implications of that for ever since. And we're only getting now to a point where we're recognizing again the critical need for mental health from children all the way up through adults. So again, there's no great place to cut, and so we have to trim and replenish. And again, it's got to be something that we can look at over time, maybe even some temporary things to fill holes. But I think we have to be open-minded, both in local creativity and family time, families and communities stepping up. But also the reality is that we will need additional investments to not feel quite as much pain and to make sure we can recover economically.
Thank you, Representative Senn, and the hour is near that we are going to wrap up now. I want to thank all three of our panelists today: Senator Wellman, Representative Senn, Representative Eslick. I know I certainly learned a ton today about all the challenges that we're facing, and I hope our audience did as well. We also want to thank you for all the work that we know that you're doing constantly right now, trying to address these huge issues our state faces. And please know that we're all grateful for that. I have really enjoyed serving as your moderator today, and I'm going to send it back to Joe now. Thank you very much.
I want to thank our moderator, Beth Sigel, and our panelists, Senator Lisa Wellman, Representative Tana Senn, and Representative Carolyn Eslick, for the candid and thought-provoking remarks today on the issue of education and human services. Please join us over the noon hour on Thursday, May 21st, to hear from Puget Sound Energy CEO Mary Kipp for a virtual conversation about the future of energy. We'll be taking a break from our East King Chambers Coalition series next week, as many of you will be enjoying a long weekend at home. However, stay tuned for details and registration information for this year's Virtual Leadership Conference, The Future of Work, kicking off Friday, June 5th, with weekly interactive programs featuring world-renowned leaders and entrepreneurs running each Friday throughout the summer. You can find all our upcoming webcasts, as well as our previous 13 programs on demand at eastkingchambers.org or bellevuechamber.org, and at the conclusion of today's program. Again, thank you to the East King Chambers Coalition sponsors, to its members, and as always, stay healthy, stay safe, and we will see you on Thursday. Thanks for joining us.